Hello everyone, we are Group E, and today we're going to be talking with you about ICD. ICD, the International Classification of Diseases, is the standard diagnostic tool for epidemiology, health management, and clinical purposes. It was designed to promote international comparability in the collection, processing, classification, and presentation of mortality statistics. ICD was triggered by the recurring problem of determining the causes of death in many countries. On January 1, 1901, ICD-1 was implemented. Currently, WHO, the World Health Organization, maintains the ICD ontology. The United States uses ICD-CM, International Classification of Diseases, clinical modification. The clinical modification is used to support disease concepts for medical billing. This ontology is maintained by the CDC. When comparing ICD-9 to ICD-10, it is easy to see that ICD-10 is far more extensive than ICD-9. ICD-9 has 13,000 codes, whereas ICD-10 has 68,000. There is more information conveyed in ICD-10's codes, and currently most countries use ICD-10. ICD-10 codes are 3 to 7 digits in length and tell much more about patient information, whereas ICD-9's codes are 3 to 5 digits in length. ICD-11 is in development and will be released in 2017. ICD-11 will use a web-based platform equipped with web-based editing, multilingual capabilities, and definitions of signs and symptoms will be defined in a structured way to increase accuracy. ICD-11 will also be compatible with EHR information systems. In conclusion, ICD is used by physicians and hospitals to indicate diagnosis for all patient encounters. With ICD, countries can compare health status with minimum variation. Essentially, it creates a standard.
Hello, and welcome to the Group F video presentation on HL7 with Alex Zalesko, Krista Oderman, Gary Manzel, and Heather Hensley. Health Level 7 International, or more commonly known as HL7, is an organization dedicated to developing standards for the exchange of electronic health information. There are currently more than 2,300 members. The mission of HL7 is to provide standards for interoperability that improve care delivery, optimize workflow, reduce ambiguity, and enhance knowledge transfer among all of our stakeholders, including healthcare providers, government agencies, the vendor community, fellow SDOs, and patients. In all of the processes, they exhibit timeliness, scientific rigor, and technological expertise without compromising transparency, accountability, practicality, or the willingness to put the needs of the stakeholders first. The vision is to create the best and most widely used standards in healthcare. HL7 was founded in 1987 and is a non-for-profit organization. In the beginning, they were focused on messages, but evolved over time to include much more. As you can see, the history of HL7 is very interesting, as it has been updated over the years and is currently on version 3.0. The standards address messaging and data exchanges, decision support, visual integration of applications, insurance claims, clinical documents such as discharge summaries, product labels for prescription medication, in both electronic and personal health records. The 7 refers to the 7th level of the International Organization for Standardization. The first level is physical, the second level is data link, the third level is network, and the fourth level is transport. These first 4 levels represent communication levels. The next 3 levels are function levels and include session, presentation, and application. This is a sample of an HL7 message. The messages are used to transfer electronic data between health systems. Examples are patient records, lab records, and billing information. HL7 messages are widely used, but most systems do not speak the language and usually require a translator.
Hi, we are Team G. In this short video, we are going to tell you everything you need to know about DICOM. Ready to get started? DICOM stands for Digital Imaging and Communications in Medicine. It is an application layer network protocol for the transmission of medical images. In non-information systems language, DICOM is a standard for handling, storing, printing, and transmitting information in medical imaging. It enables the integration of scanners, servers, workstations, printers, and network hardware from multiple manufacturers into a PACS, or Picture Archiving and Communication System. Purpose and importance. Originally developed by the National Electrical Manufacturers Association and the American College of Radiology for computerized axial tomography and magnetic resonance imaging, DICOM now controlled by the DICOM Standards Committee and supports a wide range of medical images across the fields of radiology, cardiology, pathology, and dentistry. Let's see if you're paying attention. What does DICOM stand for? A. Digital Image Converting Machine. B. Digital Imaging and Communications in Medicine. Or C. Document Image Capturing in Medicine. If you guessed B, you are correct. DICOM stands for Digital Imaging and Communications in Medicine. History. In the beginning of the 1980s, it was very difficult for anyone other than the manufacturers of CT or MRI devices to decode the images that the machines generated. ACR and NEMA joined forces and formed a standards committee in 1983. Their first standard, ACR/NEMA 300, was released in 1985. The first large-scale deployment of ACR NEMA technology was made in 1992 by the U.S. Army and Air Force as a part of the MDIS, or Medical Diagnostic Imaging Support Program, run out of Fort Detrick, Maryland. After the first and second versions, it was clear that improvements needed to be made. In 1993, the third version of the standard was released. Its name was then changed to DICOM to improve the possibility of international acceptance as a standard. The latest version of the standard is still 3.0. However, it has been constantly updated and extended since 1993. DICOM has been widely adopted by hospitals and is making its way into smaller applications like dentists and doctors' offices. The future of DICOM. Most of the major vendors of medical imaging equipment use the DICOM standard in their product design and are participating in developing DICOM enhancements. Future enhancements include the publication of the DICOM standard in XML format to open up access to all information captured, and web services to allow mobile devices to access DICOM images. Time for another question. Who uses DICOM? A. Only hospitals that use digital imaging. B. No one. Or C. Anyone that uses digital imaging, such as hospitals, physician practices, dentist offices, or vets. If you guessed C, you are correct. DICOM has been widely adopted by hospitals and is making its way into smaller applications. Here's our last question. What is the importance of DICOM? A. DICOM allows digital images to be interoperable between EMRs. B. DICOM allows imaging equipment from different vendors to form PACS, or Picture Archiving and Communication Systems. Or C. Both A and B. If you guessed C, you are correct. DICOM makes possible the interoperability of digital images as well as their storage and archival.
Hi everyone! Today we will be discussing the Accredited Standards Committee, known as ASC X12, and its subcommittee X12N, which develops and maintains X12 Electronic Data Interchange, or EDI, standards in insurance-related business processes. To begin, let's discuss XML formatting, which is largely utilized within the ASC. XML formatting, also known as Extensible Markup Language, is a high-powered web language developed for electronic business. Unlike HTML format that displays text and images currently found on web pages, XML allows for the exchange of structured data over the web. Structured data is the data residing in fixed fields within a record or file.
Utilizing the XML format, the X12N subcommittee works to exchange business information. That's where EDI comes in. EDI is an acronym for Electronic Data Interchange, which allows companies to conform to the same standard to share data electronically. By adhering to the same standard, two different companies, even in two different countries, can electronically exchange documents, such as purchase orders, invoices, shipping notices, and many others. The subcommittee oversees the task group TG2, which relates the work of multiple work groups in the healthcare field, developing standards and industry implementation guides. TG2 provides the first level of official voting in approving the standards and the co-chairs of the task group representing X12 at the National Uniform Claim Committees, the National Uniform Billing Committee, and the ANSI Accredited Standards Developing Organization Health Level 7.
The subcommittee also includes the development and maintenance activities relating to property, casualty, healthcare, life, annuity, reinsurance, pensions, and reporting to regulatory agencies. X12N subcommittee initiatives include all products and services, such as government healthcare programs like Medicare. Additionally, X12N serves as a liaison with complementary insurance standards bodies such as Health Level 7 to coordinate standards development activities. The current HIPAA transaction and code set standards, ASC X12 version 5010, regulates the electronic transmission of specific healthcare transactions, including eligibility, claim status, referrals, claims, and remittances. All covered entities such as health plans, healthcare clearinghouses, and healthcare providers are required to conform to the set standards in order to accommodate mandatory ICD-10-CM and ICD-10-PCS code sets.
We hope that this was an informative overview of the Accredited Standards Committee X12N Subcommittee. Thanks for watching.
Previously known as the American Society for Testing and Materials, ASTM International is a recognized world leader for the advancement and implementation of voluntary consensus standards. There are around 12,000 ASTM standards being used around the world today to improve product quality, enhance safety, facilitate market access and trade, and build consumer confidence. The world headquarters for ASTM International is located in Pennsylvania. It also has offices in Belgium, Canada, China, Mexico, and Washington, D.C.
The organization's mission statement is to be recognized globally as the premier developer and provider of voluntary consensus standards, related technical information, and services that promote public health and safety, support the protection and sustainability of the environment and the overall quality of life, contribute to the reliability of materials, products, systems, and services, and facilitate international, regional, and national commerce. The organization consists of committees which establish standards in their respective disciplines. ASTM Committee E31 on Healthcare Informatics develops standards related to the architecture, content, storage, security, confidentiality, functionality, and communication of information used within the healthcare and healthcare decision-making, including patient-specific information and knowledge. Established in 1970, the E31 Committee has representation from 17 countries with approximately 300 members. Standard E2369, Specification for Continuity of Care Record, defines a core set of information to be sent to the next healthcare provider whenever a patient is referred, transferred, or uses different medical facilities or providers. This standard facilitates better coordination and improved medical care for the doctors and patients. E2369 has been incorporated in leading EHR platforms such as Microsoft Health Vault. In the United States, the Office of the National Coordinator for Health Information Technology, part of the U.S. Department of Health and Human Services, has included the use of E2369 in its formal certification criteria of EHR technologies. E1384 is the standard practice for content and structure of the electronic health record. It consists of 4 different parts. The first is that it identifies the information and logical data structure of the EHR to make sure that it is consistent with the traditional paper-based patient record content. It also presents operational principles such as privacy and security that are required to guide the implementation and operation of EHRs. Third, it provides a common vocabulary for the development, purchase, and implementation of EHR systems. Lastly, it provides alternative uses of EHR content and identifies the minimum data elements that need to be available in an EHR.
Another standard is E1633. This standard provides specification for coded values used in the electronic health record. It is a standard that addresses paper and automated systems related to the documentation of the glossary to be used for the data elements intended to unify the representation of data elements in the primary record of care, other standard statistical datasets, healthcare data message exchange format standards, data gathering forms for this purpose, and data obtained from any of these formats so that the data recorded during the patient's care can be exchangeable and a source of statistical and resource management data.
Many other ASTM standards exist and are useful standards to be utilized in various healthcare processes. The following are some examples of other ASTM standards.